Hi everyone, myself Anup Dosheti from Jim's Gulbarga. Today we are going to learn about the nasal septum. As nasal septum is composed of three parts or divided into three parts, that is columella, membranous septum and septum proper. Columella septum is made up of medial crura of alar cartilage united by fibrous tissue and covered by skin on both sides. Columella is nothing but it is made up or formed by medial crura of alar cartilage which is united by fibrous tissue and covered by skin. Membranous, it is merely composed of skin without bone or cartilage. Lies between columella and antecaudal part of quadrangular cartilage. Next, septum proper. Septum proper is composed of two parts, cartilaginous and bony part. Cartilaginous part, it is made up of septal cartilage which is shape is quadrangular, so it is known as quadrangular cartilage. As it also partition between right and left nasal cavity, but also provides support to the tip and dorsum of cartilaginous part of nose. As bony part is composed of two main bones, perpendicular plate of ethmoid and vomer. These are the main contribution, but some little part is also contributed by other bone like rostrum of sphenoid, nasal crest of maxilla and palatine bone, nasal spine of frontal bone. As we can see, septum proper is two part, cartilaginous and bony. Bony is made up of septal cartilage. Cartilaginous part is made up of septal. Bony is mainly made up of two, perpendicular plate of ethmoid, vomer, rostrum of sphenoid, nasal crest of maxilla and palatine, and nasal spine of frontal bone. As I have drawn one of the schematic diagram to show the framework of septal cartilage or septum of nose. As this is crura, this part is membranous part of nasal septum. This is septal cartilage. As it is quadrangular in shape, this is perpendicular plate of ethmoid. As in early video, we have told that perpendicular plate of ethmoid and vomer are major contribution in bony framework of nasal septum. The other small frameworks are rostrum of sphenoid, nasal crest of maxilla and palatine, as well as nasal spine of frontal bone. Main by these two part and other are having little contribution in bony femur. In cartilage, mainly septum cartilage. As we now will quickly revise it. As septum of nose is made up of three parts: columella, membranous, and septal proper. Septal proper further cartilaginous and bony. Cartilaginous by septal cartilage, bony is by perpendicular plate of ethmoid, vomer, rostrum of sphenoid, nasal crest of maxilla and palatine, nasal spine of frontal bone. Now we shall further process to the arterial supply. As arterial supply by mainly two arteries, external carotid and internal carotid. From internal carotid we will discuss first. From internal carotid through ophthalmic artery we have two branches, anterior and anterior ethmoidal artery, posterior ethmoidal artery. As anterior ethmoidal artery enters to nose through anterior ethmoidal foramen, as it is situated 1.2 mm from the lacrimal crest. As posterior ethmoidal artery is located is 0.6 mm from the anterior ethmoidal artery. As they enter to nasal septum and start to supply over the antero-superior quadrant, this supplies antero-superior quadrant. This supplies posterior-superior quadrant. External carotid is branches are 8 branches, but in nose it is mainly supplied by 2 branches. Maxillary artery. In maxillary 2, sphenopalatine enters to sphenopalatine foramen, which is situated 1 mm behind the middle meatus. 1 centimeter. Next is facial artery. In this superior labial branch supplies the antero-inferior quadrant. Next, another is facial artery. Now, let us see the arterial supply, as this is anterior ethmoidal, posterior ethmoidal, sphenopalatine. This is greater palatine artery. This is superior labial artery. This is little area, which is formed by 4 arteries that are anterior ethmoidal, sphenopalatine, greater palatine, superior labial artery. As it is situated in antero-inferior quadrant, it is a common area of epistaxis. Sphenopalatine, it is known as artery of epistaxis. Now let us discuss about the venous drainage. Venous drainage is mainly by facial vein and sphenopalatine vein. As venous drainage is by sphenopalatine vein, pterygoid venous flexus, which is a branch, and facial. Now let us discuss about the nerve supply. Nerve supply is mainly by three branches. First, that is anterior ethmoidal nerve, which is a branch of ophthalmic nerve of trigeminal. This is olfactory, responsible for smell. It is only in 1/3 of upper part. It is also known as dangerous area of nose because from it is an unmyelinated nerve. From any infection can spread through this area directly into cranial cavity because of its unmyelinated nerve. This is mesopalatine nerve, comes from pterygopalatine ganglion. Last, lymphatic drainage. Anteriorly by submandibular, posteriorly by retropharyngeal lymph nodes. Let us revise in 2 minutes about the septal cartilage. Septal cartilage. Septal cartilage consists of 3 parts: columnar septum, membranous septum, septum proper. In this, we have to mainly focus on septum proper. Septum proper has cartilaginous part and bony part. Cartilaginous part is composed of septal cartilage, and bony part is composed of perpendicular plate of ethmoid, vomer, third, rostrum of sphenoid, nasal crust of maxilla, and palatine bone. Next, arterial supply. Arterial supply is mainly by 4 branches: anterior ethmoidal, posterior ethmoidal, sphenopalatine, as well as greater palatine and superior labial artery. As nerve supply is by 2 parts mainly, that is nasopalatine and anterior ethmoidal nerve, and for sense of smell, olfactory nerve, which is the also area of, it is also a danger area of nose. As we know, the septum is lined by pseudo stratified columnar ciliated epithelium. Thank you.